Welcome to my channel. One of the most crucial organs during pregnancy is the placenta. The placenta is the organ that supplies the fetus with nutrients and oxygen from the mother's body and also facilitates the removal of waste products from the fetus to the mother's system. When an ultrasound is done during pregnancy, the report usually mentions the position and grading of the placenta. Many people often ask me about these topics, so in today's video, I'll be discussing the position and grading of the placenta during pregnancy. Let's get started. What is the function of the placenta? The placenta carries essential elements like oxygen and nutrients from the mother's blood to the fetus. It helps transfer carbon dioxide and waste products produced by the fetus back to the mother's blood to be excreted from her body. The placenta secretes hormones such as progesterone and HCG that help maintain the pregnancy. It also protects the fetus from the mother's immune system. Placenta position during pregnancy. In the image, the red portion represents the placenta, and the adjacent area is the uterus. If the placenta is located at the front of the uterus, it is called an anterior placenta. In this image, we can see an anterior placenta. If the placenta is positioned at the back of the uterus, it is known as a posterior placenta, as seen in the second image. Both anterior and posterior placentas are considered normal. However, if your ultrasound, USG, report mentions a low-lying placenta, extra caution is necessary. A low-lying placenta can cause bleeding during pregnancy and may pose risks to both the mother and baby. For more detailed information on low-lying placenta, you can check out my video on the topic. I'll include the link in the description box. Now let's discuss placental grading. Placental grading helps determine the maturity of the placenta and assess whether it is developing normally as per gestational age. Grading typically begins around 18 to 20 weeks of pregnancy. The grading stages are divided into 4 categories. Grade 0, from 12 to 20 weeks of pregnancy. Grade 1, from 20 to 28 weeks. Grade 2, from 30 to 36 weeks. Grade 3, after 37 weeks, term pregnancy, most mature. What happens if the placenta matures too early? If the placenta reaches grade 3 before 32 weeks, it's called premature placental maturation, which can be a cause for concern. Potential complications include intrauterine growth restriction, IUGR, slow growth of the fetus. Oligohydramnios, decreased amniotic fluid due to poor placental function. Preterm labor, risk of early delivery. Fetal distress, the fetus may become stressed due to insufficient oxygen. Causes of premature placental maturation. Smoking or use of addictive substances. High blood pressure or preeclampsia. Gestational diabetes. Multiple pregnancies, twins. Infections. Advanced maternal age. What should be done? Regular ultrasounds and checkups. Control blood pressure and diabetes. Avoid smoking and tobacco. Do not take medications without your doctor's advice. Get plenty of rest and eat nutritious food. In many cases, if the placenta is grade 3 early and there is IUGR or fetal distress, early delivery might be recommended, either via cesarean section or normal delivery, depending on the situation. So, if your ultrasound report shows grade 3 placenta earlier than expected, be sure to consult your gynecologist promptly. I hope today's video was helpful for you. If you find the video helpful, don't forget to share it with your friends. Please subscribe to the channel to get health advice, health awareness, and reproductive health-related videos. And remember to become a member of our family. Thank you for watching this video.